Hi, my name is Rebecca Schaefer. I'm a physician assistant student at Duquesne University, and I'm going to be placing your Foley catheter today. Can I confirm your name and date of birth, please? Alrighty. So what this procedure entails is me placing a catheter, which is like a tube, into your urethra, and that will go into your bladder. I'll inflate a small balloon to keep it in place. You shouldn't feel that at all. And what this will do is drain the fluid that's in your bladder currently. This should relieve the symptoms that you're feeling from urinary retention and prevent further problems from the urinary retention. There are some complications associated with this procedure, potentially. One of them being blood in the urine. We'll keep an eye out for that. You may develop an infection, but again, this is something we keep an eye out for because it is a common problem, and it usually occurs when the catheters are left in for a couple days. For that reason, if you need it for longer than a couple days, we're going to change it and make sure to prevent that risk of infection. There's also a complication of obstruction or trauma to the urethra. Again, we're going to try to avoid that by using the proper procedures to place it. If at any point you're feeling a lot of pain or discomfort during the procedure, please let me know. And again, afterwards, if you experience any blood in the urine, leakage, fluid from the catheter, or pain or discomfort, please just let us know and we'll get it taken care of as soon as possible. Alrighty, and before we begin, I'm going to ask a couple more questions for you. First, are you allergic to any antibiotics or iodine or latex? All right, good, no allergies. And have you ever had an obstruction or any other problems like trauma to your urinary tract? All right, no trauma, that's good. And do you have any questions for me before we get started? Okay, and do I have your permission to proceed? Okay, so let me know if you have any questions throughout the procedure. I'll be walking you through it as we go, all right? I'm just gonna get my materials gathered. So I have my Foley catheter kit here. This is sterile, so I'm going to be opening it as a sterile field away from me. It's already opening for me. Okay, so I have my kit open. First I'm just gonna move it over a bit. So see it. I'll drape my patient first. So this drape is gonna go under the gums. You can lift up your buttocks. So I have them lift up and place this drape under them. This drape is just to make sure that we keep the bed dry and clean. Alrighty. So now I'll put my sterile gloves on. Okay, so I'm going to place another drape over the patient. Since it's a male, I'm going to have him sitting supine with his legs slightly apart. And I'll place the fenestrated drape over him. This whole time I'm going to be trying to maintain his privacy by keeping the gown covered until absolutely necessary. All right, now for my kit, I have my iodine here. So I'm going to pour this over the cotton balls, prepping it to clean the urethra meatus. And then I have my catheter here. So using my lubricant, I'm going to lubricate the distal tip of the catheter. And then I'll also attach my saline just so it's a smoother process once the catheter is placed. Okay, so that's already there. Okay, so now I'm going to get started with the procedure. So I'm going to grasp the genitalia and keep it erect so that the catheter goes in smoothly. And I will retract the foreskin and have my kit close by. So I'm going to do 3 swipes down the middle here. Make sure that is clean. All right. And now I will insert the catheter. So you might have a little bit of discomfort as I'm placing it, but then you shouldn't feel anything at all. Okay. So I would be inserting the catheter until I see some urinary retention. And now I'm going to inflate the balloon. And remove my syringe. Give it a little tug, make sure it is stable. And then I would tape the tubing to the abdomen, making sure that there's enough lag so that the patient's comfortable. And attach the bagging to the bed using this hook here. All right. So the catheter is placed. Again, I want to remind the patient that if they're experiencing any pain or discomfort, bleeding or leakage from the catheter, just to let us know as soon as possible so we can get that taken care of. And do you have any other questions for me? All right, so the rest of my materials, since there was no blood during the procedure, they would all go in the trash, but if there was any blood present then, or suspected blood, I would put the materials in the biohazard that would have come into contact with that. But other than that, that completes the procedure. I would take my clothes off and wash my hands. And that's about it. Thanks, Anna. Happy Easter.